called a it's a sterile core, and you have to wear a mask in this side. It's an inner hallway that leads to every operating room. So this is considered a clean side, and where the patient comes in, that's considered a non-sterile area. When the patient comes around the corner, they use that door. This door is only used for sterile supplies and autoclaves and everything we need to stock the OR.
When planning to scrub a surgical case or to assist a surgeon in the operating room, the first line of business includes ensuring that you are in the proper operating room and that at the time you enter the room, a procedure and or radiographs are not being performed. Next line of business will include putting your mask on, entering the room, introducing yourself to the OR crew, also grabbing your gloves and any other necessary assistance that the OR staff may need. Mask on. Once in the operating room, your next step is to introduce yourself to the operating room staff, which includes the circulating nurse, the scrub tech, and the anesthesiologist. Additional staff may be there, and at that time you can also introduce yourself. Hi, I'm Dr. Lindsay. I'm going to be working with Dr. Lewis today. Is there anything that you need right now?
No.
Okay. Next step that you will do is identify yourself to the scrub tech, at which time, if she does or does not have gloves or a gown, you'll need to get those for yourself. Hi, I'm Dr. Lindsay. I'm going to be working with Dr. Lewis today. Do I need to grab my gloves or gown?
Yes, Dr. Lindsay. My name is Nancy. I'll be your scrub tech, and yes, you will have to get them for me.
Thank you.
Thank you.
At Oakwood South Shore Medical Center, all of the rooms are set up the same. Our gloves are on the left-hand side of the glass cabinets, top shelf. You grab your size glove, usually ranging from 7 to 8. Females usually have a smaller size, about 6. Gowns are also found on the third shelf. Closing the cabinet when you're done. You can pause. Once you have your gloves, the next step is to give the gloves to the scrub tech. Now, once again, while in the operating room, all areas that are in blue and are sterile, you need to stay at least 2 feet away from those areas at all times. Bumping into those areas makes them non-sterile and they have to be replaced. When opening any type of equipment, medications for the scrub tech and or physician or anesthesiologist, etc., it's important that you do not touch any area that is to remain sterile. So following this technique, I'm going to take my gloves as such, expanding outward, allowing the scrub tech to grab them without, contaminating. Same principle is going to be applied when opening the gown. Our gowns come wrapped in a sterile package. You can touch this. You're going to unwrap, one forward, one to the left, to the right, revealing a sterile gown. I'm going to pass to the scrub tech and down. At which time you throw your trash away. Once I've introduced myself to the operating room staff, I've ensured that my gloves and gown are prepared. My next step before I exit to scrub is to ensure that my name is written on the board. This is not only for medical purpose reasons, but also for the operating room staff. Proper way to identify yourself is writing your first and last name and your designation, whether it be DO, MD, PGY 1, 2, or 3, or as a medical student, you would write MS 1, 2, 3, or 4. Before you exit the room to begin your scrub and begin the case, you want to make sure that you check with the OR staff and see if you can assist them in either positioning the patient on the operating table, aiding in placement of a Foley, or preparation of the surgical site. Do you need any help before I leave? May I help place the Foley or prepare the surgical site?
I'm not at this time, thanks.
Okay. Does anyone else need any help?
Nope, we're good. Thank you.
Once you've done this, again, in addition to preparing your gloves and gown, you can then at that time exit the operating room and begin your first scrub. Before you begin your scrub, you have to ensure that your surgical attire is appropriate, which includes coverage for your hair, which is either a hat or bonnet, eye protection, which preferably has side shield protection, and face mask. Again, you also want to tuck in any strings or any excess particles on your gown, including pagers, cell phones, or beepers. Again, once you begin scrubbing, you will not be able to touch any part of your body, so this all has to be taken care of beforehand. Once you've ensured that your surgical attire is appropriate, including your head coverage, eye shield, and face mask, along with any excess debris on your uniform, you can then begin preparing for your first scrub of the day. First scrub of the day should always be a wet scrub. Additional scrubs you can use the Sterilium Comfort Gel, which we will detail later. AORN guidelines recommend a brief hand washing before scrub. Beginning with the brief hand wash, I'll cut the water on. Soap. And cleanse with water. Once I briefly wash my hands with soap and water, I can then begin my sterile scrub. At every station you can find face shields, masks, and or eye shields, in addition to iodine and Hibiclens based scrub prep. Whichever you choose is user preference, there's no specification. I begin by opening the sponge. There will be a sponge with a brush, including a nail cleaner. I'll cut the water on and or off. First thing I will do is clean my nails, each tip with the end of the blue device or cleaner. Once I've done this, again I'll throw that away. I'll begin the water. I will scrub my fingers with the brush and the remaining of my hands and or arms with the sponge. Again, recent guidelines have shown that brush usage beyond the wrist should not be used. Wetting both arms. While here, I never want my arms to drop below my waist. I'm going to start from the tips of my fingers and go towards my elbows on both arms, doing each hand at a time. Scrubbing the fingers. Again, first scrub of the day should be at least 3 minutes. There's a clock that can be seen through the operating room window in each of the ORs. You can also employ the 10 strokes per side, which I will show you briefly. Once I clean my fingernails, primarily with the device and next with the brush, I can then begin scrubbing the remainder of my extremities, upper extremities. Now, a general approach can be to do 10 strokes, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, here, here, and here, on the palmar aspect of the hand. I then turn next. And then at least 10 strokes on each of the sides of the fingers. Once the hand is complete, I'll begin to move down the arm. Again, at least 10 swipes on each side, 4 sides. As I'm cleaning, I'm going towards the elbow. I'm not going to go back up towards the tips of the fingers. Once I've completed the left hand, I'll do the same to the right. Again, all 4 sides, at least 10 swipes. If done appropriately, this will take at least 3 minutes, which meets guidelines. And again, guidelines do recommend that you scrub 2 inches above the elbow. this point in time, I'm going to drop my sponge into the trash, and then I'm going to cleanse with water. Once again, maintaining elbow height above the waist. I'm going to maintain this hand. You don't want to sterilize or, contaminate your left hand. I'm going to let the water run from the top to the bottom. Moving downwards. And done. Other hand, keeping this hand non-contaminated. Top, or fingertips. Two elbows. Once I've completed this, I can stop my water, keeping hands together above the waist, making sure not to bump into anything for contamination, and then I can enter the operating room. In addition to the wet scrub, you can also utilize the Sterilium or Avidart scrub. Depending on your institution, they will either have the Sterilium or the Avidart. Again, you can utilize this as your first scrub of the day, or you can utilize it as subsequent scrubs after your first wet scrub of the day. It is recommended, however, that your first scrub be a detailed wet scrub, as we showed earlier with the iodine or HibaCleanse. If you do plan to use the Sterilium as your first scrub of the day, you still must clean your nails with the nail cleansers, as shown earlier. Again, these are located on the window at each scrubbing station. Removing all mass debris from fingertips, as shown earlier. Disposing of in the receptacle. Next, I'm going to prep both hands. Sterilium recommends at least 2 minutes of scrub time with this scrub. You will begin by moisturizing each hand and then moving from the fingertips to the elbows or beyond the elbows. So I'll start off 2 to 3 sprays, or 2 to 3 double sprays is adequate for ensuring a proper amount of scrub on each hand. So taking the nails or fingertips of my right hand into the palm of the left. Again. I'll do the same with the other hand. Fingertips or nails of the left hand cleaned. Once I've ensured moistness on both hands, which Sterilium recommends again, additional sprays can be used to clean the remaining aspect of the forearm and arm. Again, ensuring cleanliness on both sides all the way down to the area past the elbow. Palmar and dorsal aspects of the forearm. In general, scrubbing from the top down, not to go back up. It is appropriate to be wet after using Sterilium. This motion can be used to encourage drying. Again, this will dry with time, and actual appropriate use of Sterilium involves allowing it to dry. You should not use a sterile towel to dry the Sterilium. Again, once you're sterile, you enter the operating room as mentioned before, and can begin gowning either by yourself or with assistance as mentioned before. Once you've completed your sterile scrub, your upper extremities are considered sterile and you can enter the operating room. Again, this is done by either butting in or backing into the door. Walking backwards. If the door is high enough, you can use your back as such. Preferably, you do not want to use your elbows. However, sometimes you may have to. So backing in, I enter, keeping hands sterile. Once I've entered the operating room, I'm going to keep a general consciousness of staying away from the sterile field in order not to contaminate. Also, if the patient is already on the table, I want to steer clear of any sterile field there. I'm going to approach the scrub tech. He's going to have a dry cloth for me to dry my wet hands. I'm going to hold one hand out. She's going to place that. I do not touch that. I let her drop that on my hand. I'm going to take the towel, which is now in the right hand, and clean left hand, using only that side. And again, starting at the fingertips, going down. I also want to ensure that I bend at the waist, that way that I not contaminate my hands with the other parts of my body, which are from the neck down, if you will. Once I've dried off the left hand, I'm going to flip the towel using the other side of the towel to clean the opposite hand. Again, bending at the waist to avoid contamination. Flip, clean side, start from fingertips, dry down to elbows. Being conscious of bending forward at the waist. I'm going to next place the towel into the dirty linens, not dropping on the floor, which could cause someone to trip. Next, I'm going to move to gowning. If you have the benefit of having a scrub tech who can help you with the gown will be faced towards you, unsterile side out. You can extend both arms straight forward. Again, you're still right here, keeping mindful of the space around you, not to bump this or any part of the wall. Straight forward, being aware of my surroundings. Thank you. Keeping my hands above my waist. Once again, if you have the privilege of being gloved by someone, they will prepare the gloves for you. You'll grab, pull down to this level, pulling your gown down, exposing just the tips of your right hand. Again, this side is sterile. I'm going to put one hand out on the underside of the glove for stability. You go straight down and pull up. This is now sterile. Same, pulling down on the left side of the gown or left arm, gripping underhand with the right hand, and down. Once I am down, the next is to be turned. I'm going to take this. I'm going to turn to my left, grabbing. I'll next secure this with a simple shoestring knot. Current guidelines recommend double gloving for all operative procedures. So normally, again, gloving in the same manner. Normally you glove, if your glove size is a 7.5, your second set of gloves will be a size lower. So that will be a 7. If I'm a size 8, my second set of gloves will be a 7.5. So again, the same way, pulling down, and on, pulling down, and on. Thank you.
You're welcome.
I'm turned, I'm gloved. At this point in time, I'm considered sterile. Your hands should always remain above your waist. Hand placement, proper hand placement, is not considered to be under the arms. Again, at your waist or above your waist or at your chest. You want to make sure that you don't bump into anything in the operative room that is non-sterile. Once again, blue areas in the operating room are sterile. At this time, I can touch them. However, I do not want to turn my back to them, and I also want to stay at least 2 feet away from non-sterile areas. Once you have scrubbed, donned your gown and gloves, and the patient has been sterilely draped and prepped, it's important to keep in mind that, again, you are not sterile on your back, below the waist, and in the shoulders, keeping your hands in appropriate position. When approaching the operative field, you'll see the instrument table, again, which is sterile and must be avoided when you're not sterile. Also, the scrub tech will have the Mayo tray, which includes the operative instruments that are going to be used directly. The Mayo tray should not be touched by medical students and or resident physicians unless the scrub tech allows you to or when it's appropriate. Again, they must keep track of the instruments and the needles, and we don't want to interfere with this. When I approach the operating table, if the surgeon is present, I'll ask which side he would like me to stand at. When the surgeon is not scrubbed yet or not in the room, I will stand at either side and wait his instruction. Approaching the table, keeping in mind of the blue field or sterile field. Once I arrive at the table, I can put both hands, rather than keeping them on my chest, I can then place them on the table and wait until the operation begins. Keeping mindful of the Mayo tray and any other instruments that may be lying around. Once the operation is complete, the next step is to remove your gown and gloves. Before one removes their gown and gloves, you must ensure that all tasks are completed, including removing the drape or aiding the scrub tech in any way. Once this is done, you can take off your gown and gloves and help move the patient once the gown again is off, and you can use the gloves in the operating room when moving the patient. When taking the gown off, one starts by grabbing the gown. You do not take your gloves off. You grab the gown around the waist level, you pull out, unfolding the gown on top of your gloves and then remove as follows. So I'm going to pull out. If I want to, I can undo my strap here first, however this will pop. I'm going to pull out. Again, gloves still on, pulling this hand over, using my thumb to reach underneath. And again, same with the other hand. Once this is done, place it in the trash. Oftentimes you will be required to gown yourself and will not have the assistance of a scrub tech when gowning and gloving, such as joining a case that is already in progress. at which time you want to grab your gloves and gown, as mentioned previously, and you will place them as such on a non-sterile mayo tray. Again, I will begin first with my gown, opening it in this fashion. And I'll do my gloves second. Taking my gown, laying this here, pulling out, grabbing the tips, all 4 directions, not touching the gown. I'm then going to open my sterile gloves onto my now sterile gown. Again, grasping at the top, pulling outwards or apart. This comes as such, and I'm going to let this fall onto my gown. Once I've prepared my gown and gloves, I can then step outside and scrub. Once I've completed my wet scrub or sterilium scrub, I can then begin gowning myself when appropriate. First step I want to take is grabbing the gown as such. Again, with the V facing towards you, elbows above the arms at all times, elbows above the waist. Okay. I'm going to stick both hands, left and right. There's a spot here for your hands. Ensuring there's nothing to my left or right, I'm going to put in and allow the gown to drop. Where I put both of my hands are the beginning of the arms. When they're straight out as I did earlier, keeping my fingertips within the sleeves. Thank you.
You may approach your back.
Once I've been secured in the posture aspect of the gown, I'm going to step towards, again, the mayo, which is not sterile, however this is. I'm going to open my gloves. Again, my fingers are not coming through. I'm using my hands through the sleeves of the gown. Now the gloves, left hand is on the left side appropriately, and right hand on the right side. I'm going to grab the right-handed glove with the left hand, as such. One side showing a small opening. I'm going to take the right hand and place it in. Again, this can take some practice. Pulling down, again, using the left sleeve, the fingertips, and pull around and down. Again, moving on to the left glove, I'm going to grab with my right hand, which is sterile. Pick up as so. Tips of the fingers are in the left sleeve, and as such, slightly pull out and down. Now, this is something that can take practice. There is the thumb-to-thumb method, which is also appropriate. Again, you want your sleeves in your gown, appropriate place of the cuffs on the gown is at the level of the knuckles. Once I have both gloves gloved, I can either put on another pair of gloves, which is appropriate. At that time, I will turn myself as earlier, taking your tag, extending out, turning to the left, being mindful of your surroundings, not contaminating yourself, and then tying with a simple shoestring knot. Again, it's important to remember that once you leave the operating room, you must wash your hands. After every case, simply return, and a simple wash is appropriate. Also, this was not mentioned earlier, however, common sense tells us that when we do scrub, no nail polish and or watches or jewelry on the hands. Again, jewelry, nail polish, all of these are unacceptable underneath your sterile gloves. So when on your surgical rotation, again, come in that morning, ladies, with your fingernail polish removed, and all other jewelry and whatnot should be placed in a sterile place, or a secure place in your locker or at Med Ed if you do not have a locker. So once again, at the end of the day, when all of your activities are completed, return, wash your hands again, and then for the next case, you start the whole process over with either your sterile scrub, sterilium gel. You can do another wet wash as appropriate. OR etiquette is an essential aspect and a necessary aspect when working in the operating room. A general consciousness when in the OR of minding the surgical field, minding the areas that are in blue, and being where you need to be when you should be, and not where you need to be when you shouldn't be. Again, as a first rule, talking in the operating room is generally looked down upon, and unless the surgeon is talking to you or if there's a group conversation, quietness is appreciated. Also, while operating, if the scrub tech or nurse and or surgeon mentions that you may have contaminated yourself, the proper response is thank you, disrobing, and re-scrubbing again. Arguing about whether or not you bumped into something is, again, not appropriate during the operation, and it's something that's going to happen to all people, and in general, it's no big deal and nothing to be worried about. Simply recognizing the problem, and again, re-scrubbing and re-gowning is appropriate. Again, when approaching individuals in the operating room from behind, as in when you're looking or observing a case from behind a surgeon's back or a scrub tech's back, it's nice to mention, hi, I'm behind your back, I'm on your right. That way, if they happen to turn to the left or the right, they do not bump into you. Again, when radiology and or the C-arm is present during a case, it's important that you do don radiology attire and or a lead drape, and being mindful of that and x-ray exposure. Once again, operating room etiquette is very important. Working as a team, it's not an opportunity to belittle folks or to be belittled, and if we work together as a team, this can be achieved appropriately and the case can go smoothly. In addition to OR etiquette, it is also important to, again, work as a team, volunteering your services before the operation and after the operation. Volunteering to help prepare the patient, volunteering to help clean up the operating room afterwards. Again, and also assisting the anesthesiologist in transfer from the operating room to post-op. It is also important to note that this is your opportunity to learn procedures and learn clinical medicine. If there is a procedure or activity that you're not familiar with, simply asking the scrub tech and or the circulating nurse if they can show you that procedure is appropriate. Again, asking if they can show you how to do a Foley or to prep the patient. Any of these are, I guess, open game. So now is your time to take advantage of that, and again, working together as a team will facilitate that as well. Using these skills and the other that we've gone over today, you can be ensured that you will have success in any operating room that you go to. Again, this is common sense or surgical conscience that can be applied across the board, regardless if you're here at South Shore or at any of the other surrounding hospitals or any operating room throughout the country.